Hi everyone, thanks to those that have joined already. Please bear with us while we wait for any others that might want to join. Can I get confirmation that you can hear me clearly and that the sound and audio is at the right volume? Great. Thanks, Sandy and Lynn. Great, we'll just wait one more minute before we get started. And sorry, can I just get confirmation that you can see a blank blue screen? Great. Thanks, Lynn and John. And Sandy. Cheers. Appreciate it. Okay, I think we'll get started now. So hi everyone, and thank you for joining us. My name is Robert Walters and I'm a product specialist here at Medtech. Today we'll be looking at the capitated-based funding switchover enhancements. We will take any questions at the end of the presentation and try to address as many as we can. You can submit questions at any time using the online chat screen on the GoToWebinar panel. If we don't answer your questions today, please be reassured we will follow this up via email after the webinar. If you are experiencing any sound quality issues, we suggest you leave the webinar and reconnect again. That often solves the issue. We will now begin the webinar. Okay, so we'll start off with covering off the agenda for today. So to begin with, we'll cover the capitated-based funding switchover design overview and provide a high-level understanding of the switchover approach that was taken, followed by tracking and managing the CBF switchover. So key points on the switchover tracker and the management of the switchover. We'll next see what needs to be actioned by practices prior to the 1st of April and provide an overview of the actions which must be taken to ensure that practices do not miss out on funding from the 1st of April. We'll then do a live demo to view the changes made to the PMS to support the switchover, followed by a demo of the enrollment maintenance buttons and how funding is set for patients. And we'll finish off and we'll then do a review of the auto synchronization of provider CPN and facility numbers. And then we'll finish off with the Q&A session. My apologies for not clicking through those. Okay, so to start off with, we'll go through the CBF switchover design overview. Okay, so the approach taken when designing the functionality required to switch over from the quarterly CBF model to the monthly CBF model was split up into two parts. The first part involves the synchronization of all existing enrollment information to ensure that the enrollment which is being used as the basis for funding from NES matches the enrollment from the PMS. So when the bulk synchronization process runs, it will synchronize all enrollments where the PMS and NES have the same corresponding enrollment status. For example, if both of the statuses for a given patient show as full enroll, then the system will confirm the match. and then import the enrollment information from NES to the PMS, and then update NES with the provider, CPN, and facility numbers currently associated with that patient's enrollment from the PMS. After that is completed, the system will then apply the funding, which will be derived from the enrollment based on a combination of the enrollment details and the existing quarterly funding details. In the event there is a mismatch in the enrollment status from the PMS and NES, for example, if I have a confirmed enrollment status for the patient from the PMS, but no enrollment from NES, then a notification will be generated from the NES notification inbox for the practice to review and update the enrollment accordingly. The second part of the design involved us looking at how to prevent the synchronized enrollments from then going out of sync again. So this involved disabling all patient register enrollment fields after the enrollment has been synchronized, which is required to prevent changes being made to the PMS enrollment without changing the NES enrollment. Then secondly, we introduced new enrollment maintenance buttons from the patient register. So that these would allow the practice to update both enrollments with a single action, thus saving time and making the enrollment management process seamless. And finally, the system will auto-synchronize any changes to the provider CPN and facility number associated with a given enrollment from the PMS when a change is made. So we will view all of these in more detail when I demo the functionality later in the webinar. Next section is tracking and managing the CBF switchover. To track the switchover, a new CBF switchover tab has been added to the NES setup window, which can be accessed from Setup, Connected Health Information Services, NES Setup, CBF switchover tab. This allows you to track the progress of the automated CBF switchover process, update the list of staff members who will receive staff tasks advising of the outcome of the switchover when completed, and to access the CBF switchover log, which contains any errors and a summary of each switchover period completed. At the top of the tab, there is a summary of the operations that this auto switchover will process. Below this is a status which provides the practice with details of which stage of the switchover they are at. The possible statuses that will appear are scheduled to run, which appears when a processing time slot has been allocated, switchover in progress, which appears when the switchover has been initiated, and then one of 4 possible completed statuses, which the practice will see depending on if there were exceptions or processing errors or a combination of both recorded. Please note, we are processing enrollments in 2 phases. For phase 1, prior to the 1st of April 2019, all active patients with an NHI, an enrollment status, and an enrollment ID will be processed. Phase 2, from the 1st of April, all active patients with an NHI, an enrollment status, and no enrollment ID will be processed. So the key difference between the 2 phases is that first phase will process all those patients with an enrollment ID, and phase 2 will process all those patients without an enrollment ID. This means that all practices should be at the switchover in progress stage a day after upgrading and will remain in this status until the 1st of April. So one other thing to note here is while the switchover is processing, there'll be some patients that haven't been processed, which you may interact with during the day and place their patient identity onto the pallet. In this case, you'll see their funding details will show in red, and a message at the bottom of their funding details will appear, which says the CBF switchover has not been processed for this patient. Press the sync button above to manually process the switchover. Once once you do press the sync button, the enrollment will then be synchronized and the funding will be switched over. However, the red font and message won't change until after the bulk switchover has processed. So that red font and message will remain until the switchover has processed that patient during that automated synchronization step. I hope that's clear. Okay, moving on to the next section. Okay, so the next thing to note in that switchover tracker panel is below the status section is the staff task 2 field, which defaults to all staff members who currently have either access to the notifications inbox or access to the NES setup module at the time of upgrading. So the staff members who are ticked when the switchover completes will receive a single task summarizing all the exceptions, errors that need to be reviewed. The exceptions will be reviewed from the NES notifications inbox, and the errors can be managed from the view log button. So a key thing to also note here is that the staff task 2 can be modified at any time. There's no need to just leave it default to there. And as mentioned before, because of the 2 different phases, you'll only see the staff task with the summary of the process after the system completes, which is in phase 2 of the switchover process. Okay, so finally we've got the view log button. So I'm pressing the view log button. A list of all processing and connection errors that were logged during the enrollment synchronization will be displayed. A summary at the end of each switchover period will also be displayed from the log. The summary can also be used to determine if the pre-April processing has completed. This can be achieved by filtering the log for only processing summaries. To do this, select the filter button from the top left of the log window. Change the level field, as you can see in the filter logs screenshot I've got here. So change the level field to information and then press OK. A list of only the enrollment synchronization summaries will then be displayed. So as you can see from the other image that I have below, sorry. From the other image I have below there, we can see 4 records which have a summary. So for this practice, they had 18,946 patients processed from 13th of March. The next day, they processed an additional 3,000 patients. And as you can see, between the 14th and the 15th, there's very little that processed, which indicates that the bulk switchover for the phase 1 has completed. The small increment that you can see between them has resulted from potentially new patients who have enrolled, so i.e. they've got new enrollment IDs, which the system hasn't processed yet, or from patients who have had an enrollment ID synchronized since the last processing date. So that's why you'll see the increment of the small increment in the number of patients processed. Okay. So what needs to be actioned by practices prior to the 1st of April? So prior to the 1st of April, in order to prevent any loss of funding, it is important for all practices to review and update any notifications that have resulted from the enrollment synchronization process. Review any enrollments which are missing an enrollment ID using the query builder. So a pre-built query called missing NES enrollment information can be opened from the query store under the My Queries folder. So this My Queries folder has the funding status of all enrolled patients and missing NES enrollment information. So the missing NES enrollment information can be used in this case in order to find all those patients that from your system have a confirmed or pre-enrollment but are missing an enrollment ID, which means that potentially from NES they do not have an enrollment, and post 1st of April, those patients, because the system is now using those enrollments from NES as the basis for whether a patient gets funding, these patients, if they do not have an enrollment from NES, will not get funded. And this is where practices can lose out on funding once 1st of April comes through. So it's very important that you do process these patients or review these patients who are on the query builder that appear from this query and basically determine if they need an enrollment from NES or import that enrollment ID just to ensure that they do have an enrollment. Great. And in terms of the patients with the notification in the notification inbox, it's important to review those records just in case we have a scenario where they've got a confirmed enrollment from the PMS but they have no enrollment from NES. In this case, the same thing will happen come 1st of April. Even if the practice believes they should have funding, they won't get funding for that patient. Great. Okay, so we'll move into the demo. If anyone's got any questions, nobody's asked anything yet, which is, I guess, good. I hope everyone's clear on what has been delivered, and please do feel free to ask those questions if you do have any concerns or anything that you want clarified. So I'll get the demo environment ready. Oh, sorry. Let's close this. That's better. Okay, so with the demo, we're going to cover off the changes made to the PMS to support the switchover, enrollment maintenance buttons, and auto synchronization of provider CPN and facility numbers. Okay, so starting off with the changes made to the PMS to support the switchover, I'll just take you through to the switchover scheduler. So if we go to File, from Evolution, File, Options, Connected Health Information, Services, NES Setup, and then the CBF Switchover tab. So here you can see a live version of the switchover. From the drop down, you can select or remove staff members who you want to receive that staff task after the switchover is completed. And this can be altered up until the status is set to completed. Unfortunately, this view log doesn't have, we don't have any logs for this demo environment, but basically you'd click onto this view log and then you can review any errors, any switchover summaries, and as I mentioned previously during the PowerPoint presentation, you would click the filter button and then change the level to information to get a list of all the summaries, which you can then use to deduce whether the staff has completed all the patients for the pre-switchover. Sorry, pre-April switchover process. Cool. So while we're here, actually we'll close out of this now. Close. Okay, and while we're in the section, I'll just guide you. So we've also got from the query builder. So I'll take you to where the query builder can be accessed. So Tools, Query Builder, you can access the query store. And from My Queries, you can then select You can then select either funding status of all enrolled patients or missing NES enrollment information. Okay, so the missing NES enrollment information is the one that we want to highlight, just for the sheer fact that this is important for practices to run through prior to the 1st of April to ensure that funding for these patients who are on this list is going to be maintained after the 1st of April. So you'd select that query, and we do have ID for merge in here, which will allow you to place that patient up onto the pallet once we've selected them from the results section. So when I run query, I then have the ability to select any of the patients from the query builder who have come up with a C or B enrollment and are missing an enrollment ID, which means their enrollment hasn't been synchronized, and then place them on the pallet. So in this case, I'm looking at King patient. Can then open up their patient register, enrollment funding. So in terms of workflow, you would then press the sync button to see if that patient does have an enrollment. So in this case, this patient doesn't have an enrollment and it's advising to enroll the patient. You then review whether they have a valid form and whether they should be actually enrolled at the practice. And if the sync did find an active enrollment from NES, it would then import those details and set the funding accordingly. Oops, sorry, I better close this. Okay, so just one last note on changes that can be expected after you upgrade. So the PHO export utility will no longer make changes to the funding details when it is processed, and the PHO import utility and NES catch-up utility will no longer be available after the practice upgrades. Okay. So moving on to the enrollment maintenance buttons. If I bring up patient. Okay, so as you can see here, this patient, in order for you to be able to see the sync button, you have to have enrollment status, date confirmed, or a form added. Okay, let's see if we can get rid of this. Sorry, for some reason my screen is a bit. Bear with me while I get this sorted. Okay, let me shrink this window. Okay, so once you've got details in there, you can then attempt to sync. And if the sync doesn't work, we can then go into NES. And then from the NES window, we have the ability to enroll the patient. So while we're in this NES window, we then have, I just want to note that we've removed the update enrollment button, as well as any save to PMS buttons that that were there previously. So after we get into the NES compare screen, we can then press the enroll patient button, and from here we have two new fields, date confirmed and enrollment method. And these two fields have been added for the sheer fact that now all the enrollment fields are disabled, and what we want to prevent is for any practice who's entering or saving an enrollment to ensure that they do add a date confirmed or enrollment method prior to saving the enrollment, to prevent any blank enrollments, enrollment fields after the enrollment has synchronized with NES, which would result in all those fields being deactivated. So the system won't actually allow you to save until you've got something populated, and you have two opportunities to change the date confirmed before the system locks those off. So as you can see, I can make a change from the date confirmed section, select patient agrees to all the above declarations, press save. Great. And as you can see, it's set the enrollment details, and it's set the funding start date for the 1st of April 2019, which you would expect because there's no funding details. They're currently not funded because it's not April yet. And the funding end date, which you'll notice is different. Previously, it was set to the end of the quarter, which you ran the PHO export for. Now it's set based on the enrollment expiry date. So it's set to the last day of the month of the enrollment expiry date. And that's because you will still have funding for the remaining of that month after the monthly CBF model is deployed. And yeah, you would expect that patient to be funded for that period. Great. So we'll move on to the second patient. Okay, so for patient 2, so this patient is enrolled and they've already got funding for the following month. So we then have, I'll demo here that we can re-enroll the patient. So using the re-enroll button, we can select a date for when we received any form or made contact with that patient. So I can select phone. Hopefully this will allow us to re-enroll the patient. Yep. Oops, sorry. And as you can see, the enrollment expiry date extended. And in this case, the funding end date won't extend for the sheer fact that it's still March when it was. So in the event that I'd re-enrolled the patient in the future, say 2 months from now, the months would change accordingly. So with the same patient, I'll end their enrollment. So we select the end enrollment button. Then we'll select transfer and press yes. Give me the option to remove recalls. And there you can see the end enrollment has gone through, and that patient's enrollment is showing without the without funding anymore, so not funded. Sorry, I've received some questions which I can go through. If the patient's showing as not funded status, do practices have to sync or re-enroll each new patient, or is this an automated process at a set time or month end? Oh, I see. Okay, so so basically what we're going to be in is we're going to be in a state of whenever we're enrolling a patient or ending an enrollment. So enrolling a patient for a patient that's not currently funded, or ending an enrollment for a patient who is currently funded, we're going to be in a state of enrolled, confirmed enrolled, not funded until the 1st of April, and unenrolled, funded until the 1st of April, 1st of the following month. And you're right, what happens when that month comes? How is it going to be set? So we've got two processes in place. We've got a bulk monthly process, which happens at the 1st of every month. And that's initiated by Medtech Services. So what it will do is it will look at all those patients that fall into that category. So it will ask, what is today's date? So let's say 1st of April, and all those patients that are showing with enrolled, not funded, and until the 1st of April, and unenrolled, funded until the 1st of April, it will then switch over that funding status from enrolled, not funded, to enrolled, funded, and from unenrolled, funded, to unenrolled, not funded. With the second process that we have in place, I hope that was clear for everyone. Please message if it isn't. But the second process we have in place is, in the event that that doesn't run, that's going to cause problems because you want it to be set correctly. So what we're doing is, when you place that patient on the pallet, it will then set the check today's date and check to see if today's date falls within the funding range for that patient. For example, today's date is the 5th of April, and this patient hasn't been seen for a month, and they have funding from 1st of April till the end expiry. Then the system will clearly see that the 5th of April is between the 1st of April and whenever their end is, and will change their funding status from not funded to funded. Cool. I hope that's cleared up your question. Angela? Yep, so there's two processes in place to manage that change in funding status. But the patient is enrolled is the practice. Keep funding. Yeah, so if I think this is what you're asking, John, about the if the patient is enrolled, will the practice get funding? Only if they've got an enrollment from NES will they get funding. No matter what the enrollment status is showing from the PMS, it's NES which matters. So what we're attempting to do with this, with our enhancements that we put into the PMS, is to give you a basically maintain a synchronized view of what it's saying from NES. But funding is based on the NES enrollment status, not the Medtech or the Evolution enrollment status. Okay, so yeah, just to come back to the demo, we've got so we've covered off the sync, the re-enroll, the end enrollment. Just a note on the sync button as well as doing a manual switchover for practices. So practices can use that to do the switchover for any given patient that's placed on the pallet. They can also use it to sync any new data that has been added by externally, which hasn't been processed in. And yeah, and also synchronize any records that haven't been synchronized. For example, if you've got a patient who hasn't had their identity validated and they've got an enrollment from NES, you can still pull in that enrollment information without validating their patient identity. So we'll move on to the next patient. So a clear difference between this patient and the other ones is that now we've got a full enrollment button active. So if you didn't notice that before, the buttons are active based on what details are within the patient's enrollment record. So for a patient that doesn't have an enrollment ID, They won't see either the re-enroll, end enrollment, or full enrollment, but they will see the sync as long as they've got a new enrollment status, a confirmed, declined, and a method of enrollment saved to their record. As soon as they get an enrollment ID, as long as they've got a confirmed enrollment, so confirmed enrollment or pre-enrollment and a enrollment ID is required for a re-enroll and end enrollment. And in order to see the full enrollment button, which allows pre-enrolled patients to become full enrolled, that's only pre-enrolled patients, then they would need to have a enrollment status of pre-enrolled. So as you could see for the previous patient that was confirmed enrolled, they did not have access to the full enrollment button. So to take this point one step further, these buttons are there only to maintain enrollments. So we're not attempting to perform that initial enrollment. We're just wanting to maintain existing enrollments which are there. So if you do have a new patient who has never been enrolled at the practice before, or a patient who's casual that wants to now enroll, you would then have to go through the normal process as I showed it for the first patient, click NHI, validate their patient identity, and then enroll them from the enroll patient window. Okay, so we're going to attempt this full enroll. I hope it works. I haven't tested it yet, but we'll basically from here you would enter in the date confirmed. You'd enter in a method of enrollment, and you'd hit the yes button. It would then shoot off a request to NES, so this was successful, which is good. It would then shoot off a request to NES, and they would perform a full enroll from their system, and then bring that information back to Evolution for updating. Cool, and you can see that the funding details have been extended accordingly. Great, okay, so just one last point to note on this, the demo of the buttons. If the enrollment maintenance buttons are deactivated, or you're getting an error after attempting to submit one of the maintenance operations, then the view enrollment section of the NES web portal can be used to view the enrollment, to check what the enrollment status is for that patient from NES. For example, if I press NHI, so say this patient was unenrolled and I wanted to get more details, I can then go into the view enrollment section, the blue button at the bottom, and I can see where that patient's enrollment is and make any changes accordingly, or adjust. I can determine if I'm wanting to enroll that patient or not. So it's a good place to go, because at the end of the day, the main thing to be aware of if you are having difficulty with a given enrollment is that you can always rely on the enrollment status, or you can check the enrollment status from the from NES to ensure that that patient is enrolled or not, and contact the parties, say the Ministry of Health, if you need any assistance with the enrollment, or us if you need assistance with bringing that information over. So it's important that these get synchronized during this the switchover phase, and we can expect some discrepancies while the data is getting cleaned up and synchronized and so forth. Okay. So the next section is the auto synchronization of provider CPN and facility numbers. So what we're covering here is where the synchronization of the CPN and facility numbers is being performed, where it is being performed from Evolution. So the provider, so the first area is from the patient register. So when a patient, so in the past it hasn't done this, but when the patient changes provider from provider 1 to provider 2, previously it wouldn't send the CPN and facility number, but now we've got these, that change is now allowing for the CPN and facility number to be uploaded to NES to ensure the enrollment CPN and facility number is synchronized. The second area which we've updated to allow for this to be synchronized is from staff setup, members. Okay, so what we expect here is a on changing any of the details, the location or the HPI number for a given staff member, it will then synchronize those details. So changing the location can potentially mean that the facility number is going to change. So for example, if I change from CBF location to location, it will then give me a warning to say a change to Bruce Wayne's location has been detected. If you proceed with this change, all the enrollments associated with this provider from NES will be updated. Are you sure you want to continue? When you press yes, it will then schedule a task to send those details off to that enrollment and make the update accordingly. So the other thing that can change, let's see, is the HPI number. So if you update the HPI number of a given staff member, the same warning except advising that the patient's HPI number has been updated. And finally, from the location setup, so when you make a change to the facility number or the HPI org ID, it will then present a warning. So I'll just put this in to demonstrate that. 38. Oops. Apologies. So let's go to codes and defaults. Do that again. F3. 8. Okay, so you'll get a message, though it won't upload or make that change from the enrollment for those patients. It'll give you a warning message to state that the Ministry of Health and your PHO should be advised prior to making this change, as it will affect the enrollments associated with this location. Are you sure you want to continue? So the idea here is that they would get in contact with the PHO and the Ministry of Health prior to making this change, and those changes will be made from the NES database so that the funding is correctly applied to that practice. Great. So the last place where we've made a change for the CPN and facility number is with an existing utility, which is the bulk provider update utility. For those of you that haven't seen this before, basically it performs a task to change all patients from one provider to another provider, and gives you the options to transfer the patient's provider to a new provider, update patients' recalls to the new provider, and update patients' tasks to the new provider. I'm pressing OK. It will have a message stating a bulk change of the provider's associated enrollments to the new provider will result in the enrollments being updated with that provider's CPN and facility number. From NES, are you sure you want to continue? I'm pressing yes. It will then schedule a task to send those details to the NES and update those enrollments accordingly. Great. So those are the enhancements that have been put together for the switchover. If you do have any questions, we'll jump back into our presentation. If you do have any questions, please go through. Please send them via the questions section of the GoToMeeting, and I can address those. We'll give a few minutes for anybody to think up any questions. I mean, anything that you're concerned about, anything that you need clarification about, I can go through those, or anything I missed or did not answer correctly, please let me know and I can re-clarify. So while you come up with those questions, I will summarize the important parts. So if we go back to, I guess I'm wanting to reiterate this so that everybody's clear on it, is the slide on prior to the 1st of April, what we really need to do. And maybe I can just give a bit more detail. So basically what we're trying to prevent with the switchover is practices who have currently funding for a given patients who are enrolled with them, to ensure that that funding is maintained after the 1st of April. So in this case, these two actions should cover all of them, and this is where we're synchronizing all the patients with an enrollment ID and finding out whether those patients have some discrepancy between the PMS and NES. If there is a discrepancy between the enrollment statuses, then we will log a notification from the notifications inbox where you can access that notification and review that patient's details and make any changes that are necessary. For the second part to this issue, and probably the most important, is to run that query builder, the missing NES enrollment information, because these patients currently, we do not have any visibility on what the enrollment status is from NES. So the important thing here is to ensure that that patient's enrollment is maintained in NES, i.e. they have an enrollment status, and if they don't, to go and enroll that patient. And obviously, if there are any other discrepancies that need to be adjusted, then to action those accordingly. Great. So there are no further questions. I guess we'll conclude there. And yeah, thank you all for attending today's webinar. We do hope you have found it useful. The webinar and associated notes and documents will be uploaded to our webinar library for future viewing. This usually takes a few days. If you have any further questions, please don't hesitate to contact us via email. Thanks again for listening in, and look out for those notes. Cheers. Bye.